This is Daniel. He is the athlete we will be observing in this series of photos and videos. He is a 23-year-old recreational soccer athlete with no history of knee injury or especially ACL injury. The single leg lateral hopping exercise is a common exercise used in ACL injury prevention programs. As will be discussed later, research supports the use of an exercise such as this to improve knee flexion, improve knee alignment over the ankle, as well as increase proprioception in the knee to prevent ACL injury. You see that the exercise starts with a single leg stance in a loading knee flexed position. Daniel then prepares to extend the knee, jump off of that right leg, and move his body into the air. He then prepares to move laterally to his left and land on that left leg. You see here, he is preparing to land on the left leg, and finally, he lands on the left leg in a loaded and knee flexed position to be able to jump off of the left leg back to the right. We're about to watch Daniel's first attempt at the single leg lateral hop. He was not given any instruction other than a simple demonstration. Later, he will receive instruction to improve his technique, but for now, let's see how he handles the very first attempt of this exercise. So here you see Daniel's first attempt of the single leg lateral hopping exercise. He's a little shaky at first, but as he kind of gets the hang of it, he does become more confident in his movements. However, there are a number of factors to consider on his first attempt. So what exactly is going on here? His velocity is slow, which makes his movements hesitant. He doesn't seem very confident. There's quite a bit of knee motion upon each landing. This motion is not very functional in a competitive sports setting, and you do notice quite a bit of lateral translation, and he's not gaining very much vertical height with each jump. So what's the purpose of completing an ACL injury prevention program? Why are these programs increasing in popularity in recreational, amateur, and professional sports? Well, according to Schultz, video capture of ACL injuries shows that excessive valgus position of the knee associated with tibial rotation and shallow knee flexion can all contribute to a non-contact type injury. And since a non-contact injury does not involve other factors such as a competing athlete, if the athlete can learn how to control these three factors in their knee, the valgus position, the flexion, and the tibial rotation, hopefully that they can have a chance of preventing this injury from ever occurring. The main concept behind most of these programs is helping an athlete learn proper jumping and landing mechanics, and then helping them transfer these skills to a competitive athletic setting. According to one group of researchers, poor jumping and landing mechanics, as well as sudden changes in direction, can also contribute to a non-contact ACL injury. So what's the purpose of an exercise like a single leg lateral hop in an ACL injury prevention program? Well, first of all, it's a very functional exercise. It can be easily transferred to a competitive athletic environment. You see athletes jumping and landing off of a single leg all the time in different sports. And secondly, it does address several factors that might contribute to a non-contact ACL injury, such as improving knee valgus position, improving the maximum knee flexion upon landing, improving ground reaction force, and in the case of our athlete here, men are more prone to ACL injury with shallow knee flexion, and I will demonstrate later how Daniel's knee flexion improved after his second attempt of the single leg lateral hop. Here you can see a couple of athletes completing a single leg hopping exercise in a functional setting. This young woman is powering up for a layup, and these two young men are both trying to win that header by jumping off of a single leg. How is the subject of biomechanics involved in this exercise? Well, the main factor here is the relationship between the horizontal translation and the vertical height gained in the jump. We need to find the optimal relationship between the two to be able to ensure proper landing mechanics. In his first attempt of the exercise, Daniel's excessive horizontal translation contributed to the poor knee valgus position and his shallow flexion angle. As he increased his vertical translation and increased his velocity, Daniel improved the knee flexion angle, reduced his knee valgus position, and made the movement much more functional. The force required to increase the vertical height of the jump forced him to drop into a lower flexion angle and have better alignment of the knee over the ankle. Let's look at a couple of examples. One group of researchers focused on the relationship between knee flexion and proprioception within the knee. They found that poor knee proprioception is associated with an increase in ACL tears in female athletes. In their study, they found that increased knee flexion enhanced the action of the mechanoreceptors in the knee, which improved proprioception, thus decreasing the risk of injury. Here's an example of Daniel's knee flexion before he received any instruction. You can see it's relatively shallow, and even from this angle, you can tell that the valgus displacement of his knee. It's not very well aligned over his ankle. Then we see his knee flexion after instruction. You can once again tell that the knee flexion is deeper, and you can also tell from this angle that his alignment over his ankle is much improved. Let's look at the relationship between this exercise and neuromuscular control. According to one group of researchers, effective neuromuscular control is dependent upon appropriate muscular activation and lower extremity angular joint displacement. Once Daniel learned how to correct his lateral displacement and horizontal translation of the movement, he was able to channel those forces into a more vertical direction. He achieved proper muscular activation and improved the alignment of his knee. As we have learned previously, proper knee alignment over the ankle is essential to preventing non-contact ACL injury. Here we are able to see Daniel's obvious valgus knee position in that left knee before he received any instruction in the exercise. And then we see how his knee alignment over the ankle improved after he focused on obtaining greater vertical height rather than horizontal translation. So let's summarize the key points that we've covered so far. According to the research presented earlier, increased flexion angle in the knee can decrease the incidence of non-contact ACL injuries. By increasing vertical displacement and decreasing horizontal translation, knee flexion angle improves. Effective neuromuscular control contributes to better alignment of the knee over the ankle. The single leg lateral hop can contribute to this neuromuscular control and thus decrease the incidence of ACL injury due to non-contact situations. Additionally, the single leg lateral hop can be easily transferred to a functional sports setting. Let's take a look at Daniel's final and much improved attempt of the single leg lateral hop. You can see how nicely his knee is aligned right over his ankle. He has increased flexion angle, and with a little bit more practice, this can become a very functional exercise.